All right. Our last speaker is special to NPAF, special to me. Without further ado, Olga.
Thank you. Bernita, that was amazing. I love the attitude. Okay, here we go. I can tell you, I just want to quickly say, the picture hasn't been added, but the picture I hope that will be added. Oh, no, it's not. Okay. Oh, that is me and my husband, well, then boyfriend. And as I tell the story, it'll be clear, but I just wanted to give context to who that is. Okay. I can tell you the story of how I survived a devastating brain injury where I lost a myelin in a third of my brain, but I'm not going to tell you that story. I can tell you the story of my long, arduous recovery, but I won't tell you that story either. This story is about what happened a few weeks after being approved for rehabilitation. I was assessed, excited about the plan my therapist and doctors created. Let's do this, I thought, in my normal, excited manner. Days after starting rehab, after a lengthy accessorized trip from Elmhurst, Queens to the outpatient rehab center in Manhattan, I headed to my first therapy session when I was stopped and told to please go to the finance office. But I have therapy now, I protested. Not until your insurance problems are straightened out, my occupational therapist insisted. My face was hot with embarrassment and confusion. Patients were looking at me. I put my head down and headed to the finance office. On my way, I got lost. When I finally found it, I was told, wait. Sitting there impatiently, I checked the time to calculate which therapies I could still attend. But I couldn't do that math yet. Maybe the problem was a prior approval. I was certain someone in this office could fix the issue. A representative finally called me, and I learned the gravity of the situation. It wasn't that my insurance denied coverage. They were claiming they shouldn't have to pay at all because my brain injury was a result of a medical mistake. My health insurance was anticipating a lawsuit and thought that the negligent hospital should be the one paying for my therapy. The representative said there was nothing the rehab hospital could do to help me. Instead of starting therapy, as I had anticipated doing, I had to find a health insurance attorney and sue my insurance carrier. Even though I was an attorney, I could not handle the lawsuit, not with my broken brain. One day during a meeting, my attorney asked me, why aren't your doctors helping you find financial assistance or ways to do therapy until we win this lawsuit? Right, why weren't they? So I contacted my doctors and therapists for help, for suggestions about what I could do to find financial assistance until my coverage came through. But they preferred not to get involved. Maybe I had the plague because of the impending lawsuit, I thought. They could have given me exercises to do at home, provided the names of organizations that help with outpatient medical expenses, NPAF, PAF, told me to apply to the hospital's need-based programs, or who knows what other options were available, but they didn't. It took a year and I won my lawsuit as anticipated. My insurance was obligated to pay for my therapy sessions. Great, finally, I could start recovering. I was less excited this time around. Not wanting to be fooled again, I returned to the finance office to ensure they had received the information about the lawsuit. They had. However, they informed me my health insurance only covered 90 therapy sessions per lifetime. Say what? I asked. I may have added some expletives. I relayed my insurance problems to my fellow rehab patients, and I learned many of them were also experiencing insurance problems. They were either under or uninsured. They were intermittently stopping therapy because they couldn't afford it. To apply for financial assistance from the hospital, we needed our doctor's help, they had to write a letter explaining our medical needs. A handful of my fellow patients, physiatrists and therapists, were assisting them, but by and large, no one was looking out for the patients when it came to insurance problems or helping us stay in therapy or apply for financial assistance. So I didn't have the plague because of the lawsuit. I was another patient with insurance problems allowed to fall through the cracks. I didn't know then that medical debt is a huge problem in the United States. Over 100 million people living in America, 1 in 3, struggle with the weight of medical debt. One of the ways that I repaired my relationship with clinicians was by returning to school when I finished rehabilitation. I'm now fortunate to work with Dr. Rita Sharon at Columbia University. I also advocate for patients on an individual and legislative basis, most recently by working with the FDA and the American Board of Internal Medicine. My passion is to help patients get the medical care they need. Thank you for listening to my story.
Wow, Olga, we are so proud of what you have accomplished. It is astonishing, you and your daughter. And we feel humble that you started your career with us in narrative medicine.